Most older women do this every day and don't realize it's the reason they smell off. These 8 habits silently change your body's scent. Stay to the end. The last one shocks most doctors. Let's start right where many of us overlook the most fundamental step, the wash. We've all been taught to cleanse, right? But as we age, our bodies change, and so too should our approach to washing. You see, dear one, our skin becomes a bit thinner, more delicate, and those natural folds and crevices can become more pronounced. What was once an easy-to-reach area might now require a little more mindful attention. Many women, perhaps rushing or simply not realizing the full extent of the issue, don't cleanse thoroughly enough. We often focus on the broad strokes, the areas we can easily see, but neglect the hidden corners. Think about it: the folds under the breasts, the belly button, the groin area, and yes, even between the toes. These are little havens for moisture and bacteria. When you don't cleanse these areas properly, a film of sweat, dead skin cells, and microscopic debris can build up. This isn't just a surface issue. It becomes a breeding ground for bacteria that thrive in warm, damp environments. And it's these bacteria, not necessarily the dirt itself, that produce those telltale odors. It's like leaving a damp sponge in a warm kitchen. Eventually, it starts to get a bit off. Your skin is similar. The pH balance of our skin also shifts with age, making some areas more susceptible to bacterial overgrowth. This isn't about scrubbing vigorously. In fact, that can be counterproductive, irritating delicate skin and making matters worse. It's about a gentle, deliberate, and comprehensive cleanse. Imagine stepping out of the shower feeling truly deeply clean, not just on the surface but in every fold and curve. That feeling of absolute freshness is attainable. The secret isn't more soap, it's more mindfulness. Use a soft washcloth, or even your hands, to gently but thoroughly wash these often forgotten areas. Pay attention to how your skin feels. Are there any sticky spots? Any areas that still feel a little off? This isn't a habit to rush. It's a moment to connect with your body and ensure that you're giving it the gentle, thorough care it deserves. By integrating this deeper level of cleansing, you're not just washing away the day. You're proactively preventing the microscopic battles that can lead to unwelcome odors. It's a simple shift, but its impact on your overall feeling of freshness and confidence is profound. Sanya, harsh product. Now, let's talk about what you're using to cleanse. This is where many of us with the best intentions actually sabotage our own freshness. For years, we've been bombarded with advertisements for heavily fragranced soaps, feminine washes, and body washes that promise to make us smell like a bouquet of roses. But here's the often ignored truth. These products can be your worst enemy. Our skin, especially in intimate areas, has a very delicate pH balance. It's naturally slightly acidic, and this acidity acts as a protective shield, keeping harmful bacteria and yeasts at bay. Think of it as your body's personal security system. When you introduce harsh soaps, strong detergents, or highly fragranced products, you're essentially disrupting this natural shield. These products, often alkaline, strip away the natural oils and beneficial bacteria, throwing your pH balance completely out of whack. It's like kicking out the good guys and inviting the bad guys in. Once that delicate balance is disturbed, you become much more susceptible to bacterial overgrowth, yeast infections, and irritation. And guess what feeds those unwelcome odors? That's right, these very imbalances. The irony is, you're trying to smell better by using these products, but they're secretly making things worse. Many of these feminine hygiene products contain ingredients like sulfates, parabens, and synthetic fragrances, which can be incredibly irritating to sensitive skin, especially as we age and our skin becomes more reactive. That tingling sensation you might feel, it's not necessarily a sign of cleanliness. It could be a sign of irritation. Instead, embrace simplicity. Opt for gentle, unscented, pH-balanced cleansers. Look for products specifically designed for sensitive skin or those recommended by dermatologists for intimate areas. Less is truly more here. A mild, neutral soap or even just warm water for internal intimate cleansing is often the best choice. This isn't about giving up on freshness. It's about achieving it intelligently by working with your body's natural defenses, not against them. By ditching the harsh chemicals and embracing gentle care, you'll find your body's natural systems can maintain their own fresh balance, allowing you to feel genuinely clean and confident without the need for artificial scents that only mask the problem. There's incomplete drying. This habit is so simple, so seemingly insignificant, yet it's a powerhouse contributor to unwanted odors, and it's one almost everyone misses. You step out of the shower, pat yourself down, get dressed, and feel ready for the day, right? But how thoroughly are you actually drying? Here's the critical insight. Moisture, when trapped in the wrong places, is a silent harbinger of odor. Our bodies naturally have folds under the breasts, in the groin, between the thighs, even under the arms, and between the toes. As we age, skin can become a little looser, and these folds might become more pronounced, creating even better pockets for moisture to linger. When you don't fully dry these areas, you're essentially creating a warm, damp incubator for bacteria and yeast. They absolutely thrive in such environments. Think about a damp towel left in a gym bag. It quickly starts to develop a musty, unpleasant smell. Your body, with its warmth, acts as an even more efficient incubator. This isn't just about feeling a little damp, it's about providing the perfect conditions for microbial growth, and those microbes are the ones releasing the compounds that create body odor. This problem is exacerbated if you have any degree of incontinence, even slight leakage, because any moisture that sits on the skin for too long will become problematic. The solution is wonderfully simple, but requires a moment of conscious effort. After showering or bathing, don't just pat. Gently but thoroughly dry. Use a soft towel and take a few extra moments to ensure every fold, every crevice is completely dry. Lift your breasts, separate your thighs, carefully dry your groin area, and don't forget between your toes. If you find certain areas are particularly prone to dampness, you might even consider using a hairdryer on a cool, low setting, holding it a safe distance from your skin to ensure complete dryness. For intimate areas, ensure you're completely dry after using the toilet too. Just a quick wipe isn't always enough to prevent residual moisture from becoming an issue. This practice is vital for preventing not only odor, but also skin irritation, rashes, and fungal infections. It's a small investment of time that pays huge dividends in comfort, freshness, and overall skin health. Your skin will thank you, and you'll feel an immediate difference in your daily freshness. That's wiping wrong. This might seem elementary, something we learned as children, but believe me, it's a critical habit that many senior women unknowingly get wrong, leading to secret odor issues. We're talking about wiping technique after using the toilet. It's not just about cleanliness, it's about preventing the transfer of bacteria from one area to another. The fundamental rule, drilled into us for good reason, is to always wipe from front to back. This is non-negotiable, yet sometimes out of habit, convenience, or even due to physical limitations, we can become a little less rigorous with this crucial step. The reason is simple biology. Our anal area contains bacteria that are perfectly normal and healthy in that specific location. However, these bacteria, particularly E. coli, are not meant to be in the vaginal or urethral areas. When you wipe from back to front, even inadvertently, you're essentially dragging these bacteria forward directly towards your urethra and vagina. This dramatically increases your risk of urinary tract infections, UTIs, and vaginal infections, both of which can cause noticeable and unpleasant odors. As we age, our immune systems might not be as robust, and our vaginal flora can shift, making us even more susceptible to these kinds of infections. A persistent, unexplained odor often has its roots in an underlying bacterial imbalance or infection. Beyond the direction, consider the thoroughness. Are you wiping enough or too much? Over-wiping can cause irritation, especially with delicate aging skin. And irritated skin is more prone to problems. Under-wiping, on the other hand, leaves residual fecal matter, which can definitely lead to odor. The goal is gentle, effective cleansing. Use soft, unscented toilet paper and continue wiping until the paper comes away clean. If you find toilet paper isn't quite enough, consider using a bidet or gentle, unscented wipes designed for sensitive skin. But remember to pat dry thoroughly afterwards, referring back to our previous point. This habit, while seemingly small, is one of the most powerful safeguards you have against both infections and odors. By consistently adhering to front-to-back wiping and ensuring thorough, gentle cleanliness, you're protecting your intimate health and maintaining a sense of freshness that truly comes from within. It's a small ritual with immense benefits for your comfort and confidence. Thus our underwear choices. Let's delve into something we wear every single day, often without a second thought: our underwear. This isn't just about fashion or comfort. It's a silent influencer on your daily freshness. Many of us, over the years, have grown accustomed to certain styles or fabrics, perhaps not realizing the profound impact they can have, especially as our bodies change with age. The wrong underwear choices can secretly create an environment ripe for odor, and it's often overlooked because it feels so personal, so private. The biggest culprit: synthetic fabrics. Think nylon, spandex, rayon. While they might offer a smooth look or a comfortable stretch, they are notorious for being non-breathable. They trap moisture and heat against your skin. And what have we learned about moisture and heat? They are the perfect breeding ground for bacteria and yeast. As we get older, our skin can become more sensitive, and our natural body temperature regulation might shift slightly, making us more susceptible to sweating in intimate areas. When that sweat has nowhere to go, it sits, festering, creating that unwelcome musty or unfresh smell. It's a closed system, and the odor can build up surprisingly quickly. Beyond fabric, consider the fit. Underwear that is too tight can restrict airflow, further exacerbating the moisture-trapping issue. It also creates friction, which can lead to irritation, and irritated skin is always more vulnerable to bacterial issues and odor. So, what's the secret? Embrace natural fibers, particularly cotton. Cotton is a breathable fabric that allows air to circulate, wicking away moisture and helping to keep your intimate area dry and fresh. Look for 100% cotton underwear, especially for the gusset, the part that touches your most intimate skin. High-waisted styles or briefs that offer a bit more room and aren't constantly riding up can also be more comfortable and promote better airflow. This isn't just about comfort. It's a strategic move for your health and confidence. Investing in good quality, breathable cotton underwear is a small change with a huge payoff. It allows your skin to breathe, reduces moisture buildup, and actively combats the conditions that lead to odor. By making this simple switch, you're giving your body a chance to regulate itself naturally, leading to a consistently fresher feeling throughout your day. It's a foundational step towards feeling truly confident from the inside out. What's fluid intake? Here's a habit that many of us simply don't connect with body odor, yet it's profoundly impactful, especially for senior women. I'm talking about something as fundamental as drinking enough water. We often think of hydration for our skin's appearance or overall health, but rarely do we link it directly to how we smell. Yet, a surprising number of subtle odors can be traced back to insufficient fluid intake. As we age, our sense of thirst can diminish, making us less likely to drink water even when our bodies desperately need it. We might also consciously reduce fluid intake to manage bladder issues, which, ironically, can backfire. When you're not adequately hydrated, your urine becomes more concentrated. This concentrated urine has a stronger odor, which can linger, especially if you have even minor bladder leakage or don't wipe thoroughly enough. Think about it. The more potent the urine, the more noticeable its scent will be. Beyond urine, dehydration affects your entire body's detoxification processes. Your kidneys and liver work tirelessly to filter waste products from your body. When you're well hydrated, these waste products are diluted and flushed out efficiently. When you're dehydrated, these waste products become more concentrated, and your body might try to excrete them through other means, including your skin, which can contribute to overall body odor. Furthermore, hydration directly impacts your skin health. Well-hydrated skin maintains its natural barrier function better, which helps to keep bacteria in check. Dry, compromised skin can be more prone to irritation and microbial imbalances. So, what's the actionable takeaway here? Make a conscious effort to increase your water intake throughout the day. Don't wait until you feel thirsty. Sip water regularly. Keep a water bottle handy. If plain water feels boring, try adding a slice of lemon, cucumber, or a few berries for flavor. Herbal teas also count towards your fluid intake. This isn't about guzzling gallons, it's about consistent, gentle hydration. Aim for clear, pale yellow urine as a good indicator of adequate hydration. If you're managing bladder issues, consult with your doctor. Often, reducing water intake can make bladder issues worse, not better, by concentrating urine and irritating the bladder. Staying hydrated is a holistic approach to freshness. It supports your internal systems, dilutes waste products, and maintains healthy skin, all of which contribute to a naturally fresh scent. It's a simple, powerful habit that empowers your body to do what it does best, maintain its natural balance and freshness. Let's start ignoring leaks. This is a sensitive topic, my dears, one that many senior women face but few openly discuss. Bladder leakage or urinary incontinence. It's an issue that impacts millions, yet the shame and embarrassment often lead to silence. However, ignoring or inadequately managing bladder leaks is one of the most significant yet unspoken contributors to persistent unpleasant odors. It's not just about the smell of urine itself. It's about the cascade of problems it creates for your intimate health and confidence. Even minor leaks, if not addressed promptly and effectively, can cause a constant dampness in your underwear and on your skin. As we discussed, moisture is the enemy of freshness. This damp environment is an absolute paradise for bacteria and yeast, allowing them to multiply rapidly. The breakdown of urine by these microorganisms produces ammonia and other pungent compounds, leading to that distinct, often embarrassing odor. Moreover, prolonged exposure to urine can irritate delicate skin, leading to rashes, chafing, and even skin breakdown, which then makes you even more vulnerable to infection and more pronounced odors. The cycle is relentless if not interrupted. The solution isn't to simply ignore it or hope it goes away. It's about proactive management and seeking proper support. First, it's vital to use the right products. Regular menstrual pads are not designed to absorb urine effectively. They don't lock away odor or moisture in the same way incontinence products do. Invest in high-quality incontinence pads or protective underwear specifically designed for urine absorption and odor control. These products often have an absorbent core that neutralizes odor and wicks moisture away from the skin. Second, and crucially, change these products frequently. Don't wait until they're saturated. The longer a damp pad sits against your skin, the greater the risk of odor and irritation. Beyond products, please consider speaking with your doctor. Bladder leakage is not an inevitable part of aging, and there are many effective treatments, exercises, like Kegels, and lifestyle modifications that can significantly improve or even resolve the issue. Ignoring leaks silently contributes to that feeling of being unfresh, impacts your social confidence, and sadly can lead to real skin health problems. Taking control of bladder leakage is an act of self-care and empowerment. It's about reclaiming your comfort, your confidence, and your natural, fresh feeling. Don't let shame keep you from living your life fully and odor-free. You deserve to feel confident and secure every single day. Over-sanitizing. This habit is perhaps the most insidious because it comes from a place of trying too hard to be clean, but actually achieves the opposite effect. We're talking about over-sanitizing, douching, and the excessive use of harsh, feminine hygiene products. The marketing for these products can be incredibly persuasive, preying on our natural desire for freshness and cleanliness. They promise to make us feel extra clean or smell like a spring meadow, but in reality, they often strip away our body's natural defenses, setting the stage for persistent, unpleasant odors. Let's be crystal clear. The vagina is a self-cleaning organ. It has a delicate, finely tuned ecosystem of beneficial bacteria, primarily lactobacilli, which maintain an acidic pH. This acidic environment is your body's natural protection against harmful bacteria, yeast, and potential infections. Think of it as a perfectly balanced garden that needs no chemical intervention. It knows how to keep itself healthy. When you douche or use harsh soaps, scented washes, or feminine sprays internally, you're essentially bombing this delicate garden. You're washing away the beneficial bacteria, disrupting the natural pH balance, and stripping away the protective mucus layer. What happens then? The bad bacteria and yeast, which were previously kept in check, by the good bacteria sees the opportunity to multiply. This imbalance can lead to bacterial vaginosis, BV, or yeast infections, both of which are common causes of strong, often fishy odors. The very act you undertake to eliminate odor ends up creating it, sometimes worse than before. It's a vicious cycle that can be incredibly frustrating. The feeling of being unfresh then drives you to use these products again, perpetuating the problem. The secret to true intimate freshness isn't about introducing more chemicals. It's about allowing your body's natural systems to thrive. For internal cleansing, warm water is almost always sufficient. For external cleansing, a mild, unscented, pH-balanced cleanser, as we discussed in a previous point, is perfectly adequate. Avoid perfumed wipes, sprays, and especially douching. Your body is incredibly intelligent and capable of maintaining its own beautiful balance. Trust in its natural process. By stepping away from the over-sanitizing impulse and embracing a gentle, minimalist approach, you empower your body's own protective mechanisms. You'll not only find genuine freshness, but also reduce irritation, discomfort, and the cycle of recurring odor issues. It's an act of respect for your body's innate wisdom. Laundry neglect. This might seem like a departure from bathroom habits, but trust me, it's intimately connected and a stealthy culprit behind persistent odor issues in senior women. We're talking about the simple, yet often overlooked, habit of laundry neglect, specifically not washing your clothes, towels, and especially your underwear often or effectively enough. You might be meticulous in the shower, but if you're putting on clothes that aren't truly clean, you're essentially undoing all your good work. Think about it. Throughout the day, your clothes, particularly underwear and anything close to your skin, absorb sweat, dead skin cells, natural oils, and microscopic bits of bacteria. If these items aren't washed promptly and thoroughly, these organic materials provide a feast for odor-producing bacteria. They thrive in those warm, damp fibers, and the odor can become ingrained in the fabric itself, making it incredibly difficult to remove later. This is particularly true for underwear, which has direct contact with intimate areas, collecting moisture and bacteria throughout the day. If you're wearing underwear for too long, or re-wearing underwear that hasn't been properly cleaned, you're simply reintroducing those odor-causing elements back to your fresh skin. Beyond underwear, consider your towels. They absorb water, skin cells, and microscopic particles from your body every time you use them. If a towel is used multiple times or left damp in a bathroom, it quickly becomes a breeding ground for mold, mildew, and bacteria, developing that distinct, musty smell. Then you use that same towel to dry your freshly washed body, essentially transferring those odors and microorganisms right back onto your skin. It's a common scenario that many of us simply don't connect to our own personal scent. The solution is straightforward. Prioritize regular, effective laundry. Wash underwear daily. Use hot water if the fabric allows, for items like underwear and towels to kill bacteria and thoroughly remove oils and sweat. Don't overload your washing machine, as this prevents clothes from getting truly clean. Use a good quality detergent, and if you're concerned about lingering odors in athletic wear or intimate items, consider adding a scoop of baking soda or a cup of white vinegar to the wash cycle. These are natural odor neutralizers, and crucially, always make sure your laundry is completely dry before folding and putting it away. Damp clothes will develop mildew and odors. This habit isn't just about clean clothes, it's about maintaining a consistently fresh environment around your body, which is fundamental to how you feel and smell throughout the day. It's a foundational step that supports all the other good hygiene practices you're embracing. Based on our medical review. Now, this final habit isn't a bathroom habit in the traditional sense, but it's arguably the most vital, the one that 99% of women often overlook. And without it, you might feel stuck with lingering odor issues indefinitely. We're talking about the habit of regular, open, and honest medical review with your trusted doctor. Many senior women, out of shyness, embarrassment, or simply not realizing the connection, fail to discuss persistent or unusual body odors with their healthcare providers. And this silence, dear friends, can be the biggest barrier to solving the problem. You see, sometimes an unusual or persistent odor isn't just a hygiene issue. It can be a subtle symptom of an underlying medical condition. As we age, our bodies undergo numerous physiological changes. Hormonal shifts like menopause, changes in metabolism, certain medications, or conditions like diabetes, kidney disease, liver issues, or even specific types of infections like UTIs or bacterial vaginosis can all manifest as changes in body odor, sweat, or vaginal discharge. Sometimes the odor isn't even coming from the most obvious places. It could be related to conditions like skin fold infections, intertrigo, or even issues with your gut microbiome. If you've tried all the good hygiene practices we've discussed, thorough cleansing, gentle products, proper drying, breathable underwear, hydration, and addressing leaks, and you still feel like something isn't quite right, then it is absolutely crucial to involve your doctor. They can perform diagnostic tests, check for infections that might not have obvious symptoms, review your medications for potential side effects, or identify underlying health issues that could be contributing to the odor. This isn't about being overly anxious. It's about being proactive and taking charge of your health. Your doctor is there to help you without judgment. Make it a habit to bring up any concerns about changes in body odor, vaginal discharge, or discomfort during your regular checkups. Don't minimize it or feel embarrassed. Frame it as a health concern because it very well might be. A simple conversation could lead to a diagnosis and treatment that resolves the issue completely, allowing you to reclaim your confidence and comfort fully. This habit of open communication with your healthcare provider is your ultimate safety net. It ensures that you're not just treating symptoms, but addressing any potential root causes that only a medical professional can identify. It's the most powerful step you can take towards truly understanding and conquering any secret odor concerns, ensuring you live your senior years with absolute freshness and peace of mind.